Hello, and welcome back to the Death and Grief Talk podcast. I'm your host, Joelle Maldonado, and I'm also known as the Grave Woman. Any professional that has experienced any type of success in life will tell you how important a mentor has been in their development and their desire to keep moving forward to achieve their goals and surpass milestones that they've achieved along the way. As a Black woman in death care, having mentors that not only look like me, but share cultural and background similarities has been so important and pivotal in my career. Today, I have the honor of interviewing one of my mentors and beloved colleagues. This is Anita Grant, also known fondly in the digital space as the NBE Review Coach. Hello, Anita. Welcome to the Death and Grief Talk podcast. How are you?
Doing well, Joelle. Thank you again for the invitation.
I am so excited to talk to you because for those of you that are listening that may be new to the Grave Woman, Anita is my mentor in death care. She is very important to me because she is the reason that my career shifted from your everyday funeral director to funeral service educator. And you and I have talked about so many things as it relates to death care, racism in death care, disenfranchised grief, self-care, cultural competency in so many different areas. But Anita, I don't know a lot about what brought you to death care. So if you wouldn't mind sharing, how did you get into this industry?
Absolutely. Sure. So as you know, Joelle, maybe your audience doesn't, my first degree and my first license is as a registered nurse. So I was on a Navy scholarship out of my undergraduate program through the Medical University of South Carolina. And so that sort of started my federal career. And at 10 or 11 years into my service to as a Navy nurse, I decided that I would start planning for retirement. And in that research of what would I do if I chose not to do in, kind of hands-on in-person nursing or nurse management, I sort of tripped across mortuary science and funeral service. It really, I was at an event. It was I think it was either it was a recruitment event or something of that nature. And one of the tables was a mortuary science school. And so I got a chance to chat with them and confirmed what I sort of already knew, that the course, the structure of the course is, it is a anatomy, physiology, science-based curriculum. And I thought, well, I have that as a registered nurse, so that wouldn't be a difficult sort of transition. So I applied. At the time I was living stationed in Massachusetts. I applied to Mount Ida College, which is in Newton, Mass. And that's where I started my my formal mortuary science education. And unfortunately, I was not able to complete the program because I got orders to the DC area. So I graduated in 2012 from the University of the District of Columbia. So that's sort of how it really was, just an interest on my part to prepare for retirement after the military and using sort of the foundation of education as a nurse. Yeah, so that's how I came about it.
That's so interesting. And you're absolutely right. Not just the academic components of the two programs, but the compassion, the knowing how to communicate and have difficult conversations with people that they may not be ready for. I'm sure that that's a lot of what you did as a nurse. What was your specialty as a nurse?
So in the military, as anybody on this watching this knows, you're sort of, they guide your career. It's based on the needs of the Navy and the needs of the public health service, which is what I retired from. So I worked in same day surgery. At some point, I went back and got a master's in behavioral health nursing. So I would say that I'm a behavioral health psychiatric nurse as well. And then the last 10 years, I was a senior program manager. So I managed contracts for the government. So I've done a little bit of a lot of things in patient care, but also as a nurse manager or program manager. And back mentioned one of the things when you mentioned kind of the compassion, the empathy, one of the things I often share with people, I say as funeral service licensees, we meet people, especially if it's an at-need arrangement, like the loved one may have gone off to work and had an incident or had a heart attack and unfortunately died as a result of that, or whatever the sort of acute illness that causes the death, right? Especially in an at-need situation. And that's not unlike working in a hospital. People are driving down the road and they have a motor vehicle accident. In every case, in nursing and healthcare, as in funeral service, we are sort of the conduit. We're explaining to the families what's going on, and we're having to navigate the next steps. We're interpreting information, we're sharing resources, and that's true in healthcare, and that's certainly true in funeral service. So yeah, there's a lot of similarities in the everyday interaction and the personal level with families and with patients. Mm-hmm.
So we talked about the similarities, but the biggest difference that I guess anyone listening or watching could imagine is that in the hospital or at the doctor's office or in a surgery room, the goal is to keep the person alive or make them better. Where on the other end of the spectrum in the funeral home, the person has died and we can't do anything else to bring them back. All we can do is care for their family. How was that adjustment for you? Was it a hard pivot for you to now think in terms of, I can't save this person? Or did you struggle with anything emotionally where you wish that you could have, or thought that, well, if I were involved in this, maybe I could have helped in some way?
Yeah, no, it really wasn't a struggle for me. I think maybe because as an older student with older parents, I also have a perspective of, we talked a lot about anticipatory grief, right? When we think about working as funeral service licensees. And so there's some things, even in healthcare, that based on the diagnosis, we know that absent a miracle, this chronic illness will lead to a death because of the prognosis. When I look at my parents who are in their 80s, I see changes and I see, what age and time has brought on, which is very natural. And so I think maybe because I was a second degree, second career student, an older student in my funeral service program, maybe that perspective allowed me to sort of see and be able to sort of navigate both worlds without great angst. Yeah. Mm-hmm.
I think I would really struggle with that. I think I would be trapped in nurse mode. And I've actually thought about going to nursing school, but I think my biggest fear would be losing a patient, even though I don't know what the structure is. Does the doctor lose the patient, the nurse, or does the team lose the patient as a whole?
In this sort of 21st century, there's a lot of teams sort of they call them interdisciplinary teams. So there's involvement of, every specialty, including nursing, allied health professionals, the physician, nurse practitioners, PAs, any of those ancillary services. So it probably is the team. And that's probably true, Joelle, even in an outpatient setting, whether it's a long-term facility, nursing home, that sort of thing, hospice. They all have end-stage renal disease, people that are on dialysis, which is a large population of society. It probably all is structured like a team. So it is a loss of a patient as a team. Mm-hmm.
Mm-hmm. Wow. So you mentioned that you have older parents, and I know personally we've talked a lot about some of the changes that they've gone through. As a funeral director and as someone who completely understands anticipatory grief and grief, how are you navigating that experience with your parents?
Yeah. So, as in many cases, and I'm sure your audience can relate to this, whatever you professionally are, in the professional world, what you are, is sort of brought into your family conversations because you're the go-to. If you're a nurse, you're the go-to for health issues. Oh, I have this pain, I have this knot, I have whatever. Or I'm going to this specialist. What should I anticipate? What questions should I ask? What should I know? Well, the same is true as a funeral service licensee. So I use that as an advantage because I'm always I never take my educator hat off. So I'm always sort of encouraging conversations. And it's no different in my family than any other family, the conversation of the anticipated death or what is to come. So I'm always trying to sort of educate and advocate for people planning and putting their desires and their wants in writing. And I use holidays. I always, when I do like in servicing, especially for my church, I always tell people the bulk of your family is usually around on the holidays. So take advantage. I mean, don't let that be right after Merry Christmas or Happy Hanukkah or Kwanzaa. Don't let the next words be, oh, have you made your funeral plans? But some way, make sure you kind of bring that into the conversation because you have an audience, you have a captive audience. So that's what I do. That's what I've tried to do. And also sharing, in a sanitized way, sharing some not so great observances of families where they did not have those conversations, where they did not plan, and the unfortunate outcomes of that, whether it was the emotions that happen because people don't know or they're uncertain how to follow through, and also the unfortunate outcomes financially when estate planning isn't in place and that sort of thing. So just using that to say, let's talk about it. Let's put things in place. Mm-hmm.
Wow. So what is it that you want before we even get to that question, I know that you are extremely passionate about helping others become funeral service licensees. Could you talk a little bit about what it is that you do to do that?
Yeah, so I'm going to say my why first. So I'm from a very large family. So I have a blended family. So I have 11 siblings, and you can do the math, probably, I don't know, times 3 or 4 in nieces and nephews. No, not that many, but a lot of nieces and nephews. It's a large family because we are a blended family. So as a student, I'm probably the AB student, but I test very well. I do very well on standardized tests. Mm-hmm. I have relatives, siblings, my husband's a physicist, very smart guy, but he does not test well on standardized tests. My sister, very, very bright nurse practitioner, A student in nursing school, same nursing school. We attended the same nursing school. And yet she did not pass the NCLEX, which is the standardized test for nurses. My niece, education major, struggled with that praxis, which is the standardized national test for teachers, but yet a good student. And so those observances, as well as my experience as an adjunct mortuary science professor, really made and gave me a lens for the fact that national board exam for the arts and the science really has been a challenge for a lot of professionals across the country. And also the fact, when I started out formally in our program in April of 2019 as a business, at that time, there weren't a lot of resources around support for success on the national board. And so yes, I am passionate about it. I am also, whether people hear of me or know me personally, one of the messages that I hope is very, very clear is that they're bright, they're smart, they have completed those mortuary science programs, those accredited programs. And my hope is that people are encouraged in the process to success, whether they choose to use us or not. I want them to know that it is not a reflection of their aptitude at all. It's not, because I meet professionals every day and they're like, Miss Cran or Anita, I did well in school. I'm a smart person. I know this industry. I love what I do as a professional. I just cannot seemingly pass or be successful on that exam. And so I say I bridge the, the concepts of the academic program to the components of that MBE so that people can be successful. Yeah.
Beautiful. And I have to say that that is what you exude, even with me. And I tell you this all the time, you're an answer to a prayer for me. I'm sorry, love is moving around here in the background, making noise. But that is what you make all of us feel like, that we can do whatever it is that we have the opportunity to do. So thank you for that. And before I met you, I heard people talk about mentors and why you needed one and how important it is to have a mentor. And I didn't truly understand that until I met you, Anita. So thank you. Who have been your mentors?
Well, I'd say my first cheerleader. I don't know if she's really a mentor, but my first and forever cheerleader is my mom. My mom will pump you up and make you think you can lift the world. Take it by both hands. I mean, anything, even today in her 80s, I call my mom, FaceTime her if she can figure out how to accept that FaceTime. I'm sharing ideas. She's like, go for it. You can do that thing. You can do that thing. And I'm like, haven't even heard the whole A to Z, but she's like, you can do it. Make sure you pray, but you can do it, Anita. And I'm like, oh my God, my mom's the greatest. She's such an encourager. So she's my first cheerleader, but professionally, mentors, gosh, I have a lot. So I will say this, because, I'm a serial entrepreneur. I'm a retired Navy nurse. So in every profession, I have mentors. So I have mentors in the uniformed services. One of them, Captain Beverly Dandridge, is probably my first mentor in the United States Public Health Service. She's a nurse as well. I have mentors in funeral service. Michelle Reese Wiseman of Wiseman Funeral Home in Clinton, Maryland, was my first employer, and she also was kind enough to give me an opportunity to complete my first licensure apprenticeship. Nancy Percenti of Maryland is another funeral service mentor of mine. So I have mentors, like I have others, but I'll stop with those individuals. But I hope it's very clear that I think for as many professions that you have, it might be a good idea to have a mentor in that profession, because they're going to sort of help navigate some of the landmines, things that, that aren't written. You're not going to find them anywhere, but it's a need to know in the industry. And they're going to cheer you on when it gets kind of dark and you feel like, I don't see my way. I feel like giving up, but I know this is a calling for me. So I'm very, very grateful for those ladies for taking the time and being there for me.
I don't know if I've ever told you this story, but I'm going to tell you the greatest lesson that you've taught me, because I believe in giving people their flowers. And it was a lesson in ego and clapping for everyone. I had a huge opportunity to do a huge piece of press about 2 years ago, or maybe a year ago. And my spirit told me when I was interviewing for this process and when I was in contact, each interview I had, my spirit would just tell me, you need to pass this on to a person. I'm not going to say who it was, okay. But I was like, oh no, I want this. This is for me. This is for me. And every time I would talk to the organizers of this big piece of media, it was like, this isn't for you. This isn't, you're being presented this opportunity to hold the door open for someone else. But my ego wanted it for myself, right? Okay. And I remember, I didn't tell you what was going on, but I remember I called you to share with you some other great news that had happened. And you were so very excited for me, Anita. Like I could hear, feel, and I could just sense the genuine excitement you had for me. And it really taught me in that moment. It was like, if Anita, as much work as she's putting in and as hard as she's working behind the scenes, can be this excited to see me get this acknowledgement, why can't I hold the door open for someone else and genuinely, from my heart of heart, me? Wow. And I will never forget that.
Oh my goodness.
Never.
Thank you.
So thank you for being that, Anita. That is truly who you are. And I appreciate you for that.
Oh, thank you so much. That's powerful. That's really powerful.
It is. And it's a lesson that has been so valuable for me.
Absolutely.
Not only in that moment, but just in everything that I do, and being intentional about recognizing the spaces that are for me and for other people. And not only that, recognizing the importance of making space for others. It's not always all about us.
Very
and
true.
God used you to show me that. So
thank you so
last question for you before I just give you the opportunity to share about what you're doing and where everyone can find you and learn about your new merchandise. What is it that you want your legacy to be?
Oh, what do I want my legacy to be? Well, I want people to say that I'm a person of integrity, that I'll use what you just shared, that that I presented opportunities for people to like soar, that I saw something that they may not have seen professionally or otherwise. And I just kind of helped them, supported them to kind of grow that, to explore it more. And if it's in their timing and their desire, to just kind of push them. Because I know a lot about a little bit about a lot of things. And so, I can just hear it. I think that's a gift, that I can sort of hear people share their vision professionally, or some of their desires, and I can kind of tease that a little bit. So I hope that that's what I'm known for. Definitely in the world of mortuary science, I pray that the families that I've served and will serve in the future feel like I've been empathetic and present to support them through that process. For those individuals that seek me out as an exam coach, that they went from, discouraged and not licensed to like pumped and encouraged and feeling like I got this. I told people, I want you to go in there and I want you to attack the test. That's how I really want you to feel. Like, I'm not coming in there anymore. I'm not coming to this exam. Pearson VUE, this is it. I'm not giving you any more money. I'm testing today and I'm out of here. But, I know that people are going from apprenticed, or, they're beyond that point because their apprentice licenses, long gone years and years ago, but they're going from unlicensed, but educated, to licensed. And that is significant. That's changing lives. That's changing families. That's changing the trajectory of homes, because not only what it does financially, but what it does psychologically. To know that this, but you can't give to that exam the way that it wants it, so that it, reads pass. And so for me to be able to support that is tremendous. And person after person after person, I hope that that's known. As a wife, I pray that I'm regarded as a a great partner and a supportive spouse and a great bonus mom, great sister and daughter, and a lover of God. I hope that's what people remember me for. Yeah.
Definitely. I'm confident that you will be remembered as all of those things.
Thank you.
So before you go, I know you have some new merchandise, and where can those that need your coaching and your encouragement find you, and what exactly do you have to offer them?
Yes. So on all social media platforms, which is just Instagram and Facebook. We don't have Twitter. So Instagram and Facebook, we're NBE Review Coach. Our website is nbereviewcoach.com. And my email address is nbereviewcoach@gmail.com. So we're pretty consistent with that across social media and in contact. So we offer two types of review courses for those individuals who are testing for funeral service licensure. So we have an in-person or virtual intensive 2-day review. The in-persons are held here where I am in Woodbridge, Virginia, and Woodbridge is about 25 miles south of Washington, D.C. We offer a single course for the arts It's a total of 12 hours of academic or didactic lecture, and we offer a second course for the sciences. Those are held over a 4-day weekend for anybody that needs both of those opportunities. We also have an 8-week review course. And I like to say that the 8-week is ideal. Certainly people use their own judgment, but that course is ideal for anyone who has been out of school for more than 18 months, or for the professional who has had 2 or more unsuccessful attempts at either exam. That's designed so that we meet for 90 minutes each week as a lecture, and then you receive a 2-month calendar that tells you what to study and how much. It's very, very specific, very customized on what to do those other 6 days of the week. So the Monday is specific for arts, 5:30 to 7 p.m. when we are in session for a review course. And Tuesdays are designed for the science review course. And again, that's 5:30 to 7 p.m. Eastern Standard Time. So we've been doing both of those in some fashion for the last 2.5 years or so. And we have a great success rate. When we look at the national average around the arts and the science, those numbers are less than 70%. I mean, for the first time examinee, it's less than 70% for both. And our success rate for the arts is 77%, and for the science is 80%. Keeping in mind that most of our clients are repeat examinees. So the repeat examinee rate is even lower than what I've mentioned. So we know we're doing something right. I think in part it is the academics or what we're sharing in the lecture, but I also think that it's having someone who's keeping you accountable for your time and effort and determination to kind of get this over and done with. I think it's also the resources. We streamline the process so that people know with confidence. One of the things we heard early on, Joelle, was that people felt like they were all over the place. They didn't know what to study, how long, people pulling out stuff, papers from school, quizzes. And when you feel that scattered, it's not efficient and it's not effective. But we've streamlined the resources so that we have confidently said, if you give X number of time every day to these resources, in this way, you're going to get across the finish line with that exam. So that's been a win for us, and I think a win for our clients as well. So yeah, so that's what we offer. We also have what we designed and put forth in terms of merchandise. We have the only flashcard deck of terminology flashcards for the arts and the science. It's about 1,200 definitions for each of those areas. These are the definitions that have been approved by the American Board of Funeral Service Education. They are the licensing group or the accrediting group behind the 58 accredited colleges and universities for funeral service. So we designed those about 2 years ago, and those can be found on our website. We love them because, again, when you're studying old school way, most of us learn early on in grade school, middle school, high school, that flashcards are really great. And it's another way that people can partner. I always tell people, you got some family out there, you have friends, funeral home colleagues that want to support you. Take 100 flashcards to work. When you get a break, you can have them give you the word and you give your own version of that definition back. It's a good way to involve others. But for the kinesthetic or the action learner, being that movement, something different than a book to hold, is a great way to learn as well. So you're messaging to your brain a different way to learn, and across the board, it's all very effective in being able to retain that information for the exam. So in terms of merchandise, I shared with you earlier before we went into our recording that we now have this shirt that we're making available. It says, I don't know, aced it on the front, and on the back it just has National Board Exam for Funeral Service in our website. So this is a great, I think, congratulatory merch for those that have tested successfully, or if someone's in your life who you just want to encourage. If I were testing I certainly would wear this when I'm studying on the days that I just need a little bit more motivation, because it's a visual, right? Some
Yes.
people just want to have that visual kind of like licensure on the board, shirt on my body saying, I'm going to ace this thing. And so we're really excited. We give that, of course, to all of our clients that are in 2023 and going forward a part of either of our review courses. So we're super excited. We're always trying to think about what's next and what we can offer, again, in the spirit of the National Board Exam and encouraging professionals to success. So
I can just see, like you mentioned earlier, when you work in a funeral home, you become a family. And if you're studying for that national board exam, I don't care how hard you try to hide it and keep it to yourself, people find out. And so just being a licensee or a tentative licensee walk in wearing that shirt and letting their coworkers know, I aced it without even having to say it. I can just envision that.
Yeah, I love
But
it.
when you were speaking, you got so technical about the way that students should study. I was going to ask, what do you think makes you such a good test taker? Is it just a natural ability, or is it that formula?
I think it's that formula. I also think that that it's also like sometimes we never really have an opportunity as adult learners to have somebody assess sort of how you learn best, right? Like we know we say, and we know in research there is the auditory learner, there's the visual learner, and there's the kinesthetic learner. But we don't all have experiences where information has been given to us in a way, especially in mortuary science programs, or maybe I'm wrong. Maybe I'm making an assessment that's not true across the board, but there may be cases where we've not all had an opportunity to be assessed and know what our sort of lane and our preference would be, but also to have information, especially as it relates to the national board, to be presented that way. And so I think one thing that's unique about our program is that we do ensure that we're addressing those type of adult learners. The other thing that I think is unique is that we talk about this whole issue of test anxiety. And I know for sure fact that most programs do not address that. But you all research tells us that same brain that's trying to download information to give to that national board is the same brain that's just wrecked and nervous. And so I never tell professionals that you need to not be nervous, because that's unreasonable. We're made so that anxiety sort of moves us to be on time. It moves us to be accountable, to wake up, to get dressed, to be where we need to be. So it does a lot of positive things, but when it's extreme, it can also prevent you from being able to give those correct answers on that national board. So we talk about that. We talk about that in the review course. We talk about how to frame past unsuccessful attempts, because it is a reality that you're going back the third, the fourth, the fifth, the sixth time. That is going to impact you psychologically. So we address that. We address the elephant in the room, and we allow people to verbalize and express how that feels. And then we give you some tools to frame it in a way that it fuels you instead of hinders you. So we address some of the things, I think, in a way that's very healthy and helpful, that then allows people to kind of go for it and be successful on the exam. Yeah. And then a lot of people tell me, Ms. Grant, I don't want to show up and you ask me if I studied and lie, so I just go ahead and study. So, so I think just that accountability, like, every week we're meeting, or if it's the weekend, people have sacrificed, they made trips, they come to Woodbridge, they've flown in, they've driven in, that you're coming, and that investment of your time, you're going to make sure that you're present in the room physically and mentally, and you're going to go for it, and you're going to make sure that you get all that we have to offer. So I think it's a combination of a lot of things that make it all happen.
Definitely. Well, we are out of time, but I just wanted to say thank you again for taking the time to chat with me today, Anita. All of Anita's contact information, social media information, and links to all of her services and products will be listed in the description for either this video or podcast. But Thank you so much for everything that you do for death care, everything that you've done and do for me. And I think you're awesome. And I can't wait to have you on as a guest again. I think this is number 3 or 4.
Yes. And thank you so much. And I appreciate you and all that you've done for me, because you have an exposure and you're millennial, and my brain, I don't know all of the ins and outs of things. And I will often, your audience needs to know, I probably on speed dial. I have Joelle on speed dial. I'm like, no, I don't know what I'm supposed to be doing. So I appreciate your patience and just your encouragement. Everybody needs somebody encouraging them. So I appreciate all your feedback and encouragement, and opportunity to be on your platform. That's tremendous for us. So thank you so much.
Thank you, Anita. And thank you each and every one of you for listening on Spotify, Apple Podcast, or wherever you're listening or watching on YouTube. Live life, love hard, and we'll talk to you next time. Thank you so much for listening to the Death and Grief Talk podcast. To learn more about The Grave Woman, visit www.thegravewoman.com. Live life, love hard, and we'll talk to you next time.